A couple of guests joining us at the desk right now from Broadlawns Medical Center. We do have Dr. Paul Baumert joining us. He is next to Jason Parkin. Dr. B, welcome to the show. Appreciate it. And Dr. Michael Foggia is here. Dr. Mike, welcome to the show as well. But
thank you.
We are here to talk about Broadlawns and the urgent care facility they have, the urgent care clinic.
So when I was growing up, if you got sick at night or on the weekend, you know, it was like, well, just tough it out till the next day. And that's not the way the world is anymore. And you guys have a very accessible urgent care area at Broadlawns, don't you?
Yeah, we do, and we're proud of that. You know, the main complaint people have that I hear, you're sick on Monday, you want to be seen on Monday. You don't feel good, sore throat, cough, congestion, whatever. So what happens? You call your doctor, oh, okay, I can work you in on Friday. Well, I'm sick today. So what we can do is we'll see you today while you're sick and not feeling good and need intervention and want intervention and deserve it. And we'll take care of you today. And then we'll arrange follow-up with your family doctor or one of our family physicians.
See, that really is a pain for a lot of people, and you made the effort to call the doctor, and then the doctor puts you off for a couple of days, and you get upset when that happens.
Well, you do, and it's really not the doctor's fault. With managed care and all the HMOs and PPOs and everything else, XYZ, that every family physician has to deal with, they have to tighten up their schedules, fill up their slots, and see as many patients as they can in those 15, 20-minute visits. It's not their fault. It's a system. So we are part of the system that can help you get access when you need care, and then follow up with your family doctor.
Now tell us, if you would, doctor, what the difference is between the ER, the urgent care, and then maybe your primary care physician, your normal doctor, quote unquote.
Well, non-urgent medical conditions, you know, can oftentimes be scheduled or can wait until you get that appointment a couple of days later when you feel like you need to be seen, or for follow-up for chronic medical problems, diabetes, high blood pressure, high cholesterol. But in between that is conditions we call urgent care or convenient care, immediate care, as Dr. Foggia said, where we can see patients and try to figure out it's not a life-threatening emergency. It's not chest pain, shortness of breath, something where you're going to call 911, but you want to be seen. You're sick, you want to have it addressed, and you want to have it addressed in a place that's got great facilities, great physicians, and most of all, I think that a personal approach that you can follow up with your family doctor, or we can plug you into one of our primary care doctors.
You know what I particularly like about your situation, having the urgent care facility right there, is that in case anything else does need to be done, all you got to do is open a couple of doors and you can go to that area, can't you?
I think that's probably one of the best kept secrets about our urgent care and our environment there is we are literally, as you said, next door down the hall from the emergency room. So if we find out that something's going on is a little more serious, we call our colleagues down the hall and say, you know, we're going to bring them down.
Yeah.
Does it happen very often? It happens more than you would expect. You know, people just don't realize sometimes how sick they really are, and it needs further investigation. I mean, we've diagnosed throat cancers in the walk-in clinic, and in the same day, you know, had them staged, get them set up with the oncologist, get them set up with the, you know, all the specialty care that they need the same day. You can go into Broadlawns and get a CAT scan or an MRI or a ultrasound and get the results the same day, which is unique to our facility.
It's one-stop shopping.
Right, and then you go to the radiology suite, you get your test, you come back to us, to the walk-in clinic, we give you your results, and then we plug you in where you need to go.
All right, Doc, now here's another question. I come to the urgent care part of Broadlawns. I'm feeling very bad. I got to go to urgent care. I come in, and then it comes down. You guys correct everything. You get me on the right track. It comes down, and I got to get my insurance card out. The urgent care area, is that taken care of as an urgent care area?
Yeah, urgent care is different than the emergency room. Most plans don't have any kind of pre-authorization or extra co-payment like you would in an emergency room. We're basically like an extension of our primary care clinic. We're also an extension of the emergency room in the sense that, you know,
in case you need it.
In case you need it, right. We don't take insurance cards and decide whether we're going to see you. We see everybody, which is a little bit of a misconception. I think in years gone by, it used to be that, well, if you didn't have insurance, that's where you went.
Right.
We've changed that. You know, our strong leadership and our financial and clinical background in those folks have brought people in who can manage every aspect of the insurance. So Broadlawns has got a lot of experience over the years making the most out of very little that people have. Now, we're poised to do that with changes in healthcare, but if you got insurance, come and see us, as Dr. Foe just said.
And who are you going to see when you go to the urgent care clinic? What types of specialties will the physicians have there?
At the urgent care clinic, well, Dr. Baummert's board certified in family practice. He's done a fellowship in sports medicine.
Oh, really?
Yes, and I'm dually board certified in family practice and emergency medicine. You get, between the two of us, about 50 years of experience. And then we have another doctor there, Dr. Matthew Spitzenberger, board certified in family practice, a very experienced physician. Then we have a number of nurse practitioners and PAs that also work with us, and they, in and of themselves, have their own specialties. Chad Bradshaw, he specializes in cardiovascular disease, and he works in our cardiac clinic also. Then we have a couple of nurse practitioners that have many number of years of derm experience, and other practitioners that just have a variety of experience. But there's always one of the physicians there, and you're going to be seen by an experienced practitioner or physician.
So obviously
Great.
somebody's going to go to their primary care person first in case they're not feeling well, and if they find out that they can't get into the end of the week or a couple of days and you're sick today, this is what you might want to consider. Head on over to Broadlawns, wouldn't you say?
Absolutely. Like I said, we have extended hours compared to the primary care clinics. We have our own primary care providers if you don't have one.
Monday through Friday, 8 to 8, and then even on Saturdays, they're there from 9 to 3. So that is awesome. Well done.
Yep.
Thank you, gentlemen. We appreciate it so much.
You.
Thank you for
Yeah, nice to meet you.
Thanks for having us.
Yeah.